Hello everyone, welcome to my YouTube channel where I'm going to go through different types of nursing theories with you. So this is my very first video where I'm going to start my first series on pharmacology in nursing. Pharmacology in nursing is very important to learn. So through my PowerPoint presentation, I'm going to go through one and each theory that we need to know in pharmacology for nurses. So the first lecture would be Introduction to Pharmacology in Nursing, which is the foundation of pharmacology itself. So let's go through this lecture. Throughout this lecture, I will be talking about the general introduction, pharmacokinetics, pharmacodynamics, pharmacotherapeutics, and final tips and takeaways. Some of these terminologies you might not be familiar with, but don't worry, we are going to learn each one of them separately. This lecture series, especially Introduction to Pharmacology, might not be in the same video. I'm going to make it in parts because it will allow you to absorb one thing at a time. So in this lecture, we will mainly focus about the general introduction and also absorption that belong under pharmacokinetics. Basic introduction. Let's define pharmacology. Pharmacology is the scientific study of the effects of drugs and chemicals on living organisms, encompassing how they are absorbed, distributed, metabolized, and excreted, as well as their mechanism of action. So the definition might be a bit long, and you usually don't have to recall this definition itself, but it's really important to understand the meaning of this because that's the foundation of pharmacology in nursing. So we are talking about medications that we use as nurses, and also we learn about the effects of that medications or drugs, which are basically chemicals that we use on living organisms, humans that we are, which usually goes through different phases such as absorption, distribution, metabolism, and excretion. And we also learn about the effects of those drugs into our body as well. These substances may be chemically administered to achieve a beneficial therapeutic effect on some process within the patient. This word therapeutic effect, you will hear it a lot when you're studying nursing. It's mostly to give a good effect on the health of the patient. It might be preventative or it might be treatment for a certain health condition. Okay. In nursing, we mainly study three aspects of pharmacology, which is pharmacokinetics, pharmacodynamics, and pharmacotherapeutics. Let's dive deeper. So pharmacokinetics is simply what our body does to the drug. Mainly undergoes four main phases: absorption, distribution, metabolism, and elimination of drugs. So just remember it simply. Pharmacokinetics is what our body does to the medication. Second one is pharmacodynamics, what the drug or the medicine does to our body. The biochemical and physical effects of drugs and the mechanism of drugs action. So A and B might sound similar, but it's totally different. Pharmacokinetics, what our body does to the drug. Pharmacodynamics, what the drug does to our body. Pharmacotherapeutics is going to cover majority part of pharmacology nursing because it's the use of drugs to prevent or treat a disease. So we are going to learn about a lot of drug classes that are commonly used in nursing, such as analgesia or painkillers, antibiotics, medicine for diabetics, cholesterol, blood pressure. So we're going to learn a lot of drug classes. So pharmacotherapeutics is also really important. So we will talk about some common branches of pharmacology that you might come across, but this is really not important. It's just to give you a general overview about pharmacology itself. So there is clinical pharmacology, specifically studies drugs in humans aiming to optimize drug use and develop new therapies. Toxicology is studies that studies harmful effects of chemicals and drugs on living organisms, which might be really important in terms of developing antidotes or like things to overcome toxic situations. Medicinal chemistry is focusing on the development of new drugs and the improvement of existing ones. Pharmacoepidemiology is studies that focuses on the interactions between drugs and human populations, investigating benefits, risks, and use in real-world conditions. These ones are mostly pharmacological branches that lean more towards research aspects, so you might not come across these ones as nurses. Okay, so the first one is pharmacokinetics, which is what the body does to the drug or how the body handles a drug. So this one is really important to know as nurses. So let's go through what's going on. Pharmacokinetics has four main phases, which is absorption, distribution, metabolism, and elimination. Just need to remember that all these four phases happens according to this order. Absorption happens first, then distribution, then metabolism, and then elimination. I have used a picture here to just give you an overview of these four phases. But remember, although it mentions absorption here, absorption can happen from any part of the body. So I'm not going to dive deep into this picture at the moment because we are going to talk about this more later. Okay. Before moving on to absorption of drugs, I want to talk about route of administration of drugs because it's easier for you to understand absorption when we talk about the route of administration first. So route of administration of drugs might scare you because if you're not familiar with the term route. So route, or some may call it route, it simply means where the medication enters the body. So there are actually a lot of ways a medication can enter the body. So the first and most common one is oral, which we usually use the abbreviation PO, which stands for per oral. So it's taken by mouth and swallowed. So there are different routes according to like how we take the medication. So it's specified here swallowed. You will realize why it is specified as swallowed later. So common example is paracetamol tablet. Next route is sublingual. We use the abbreviation SL. Placed under the tongue for absorption. Most common example is GTN spray or glyceryl trinitrate. You just don't need to know this medication at the time. I'm just giving common examples. But if you are curious, you can just research on your own and see how these medications work. Next route of administration is buccal, which is placed between the gum and cheek. Common example is midazolam buccal solution, which is used for seizures. Next one, topical or transdermal, which is applied directly to the skin or mucous membranes. Hydrocortisone cream, buprenorphine patch are most common examples. It can be any type of cream or ointment that you put on your skin or any type of patch that you put on your skin. Inhalation is usually breathed into the lungs through the mouth or nose. Can be any type of inhaler and also nebulizer. Next route of administration. These ones are actually quite interesting among nursing students. So the first one is intravenous, which we use the abbreviation IV. It is actually about injecting medications directly into a vein. This is commonly done using IV cannulation. So most common examples are IV antibiotics such as ceftriaxone, IV fluids, and also morphine. Second one, not actually second one, next one is intramuscular. We use the abbreviation IM, injected into the muscles. I would recommend to do further studies on common routes of IM administration. There are different muscles that we commonly use to administer these types of injections. You can just go to Google image and search for this one. Common examples are vitamin B12, influenza vaccine. Next one is subcutaneous. We use the abbreviation SC. So it's injected into the fat layer under the skin. This is also a very commonly used route of administration among nurses because of insulin. Insulin is given through subcutaneous route. And also Clexane is also more common, which is enoxaparin. Intradermal, which is used abbreviation ID, is not that much popular, but it's actually into the dermis, just under the epidermis. You just poke it parallel to the skin, directly under your skin. Most common example is tuberculin test and allergy test. Next route is rectal, administered via the rectum. This is also important, and also just need to remember as nurses to use lubricants when administering through this route because it can be painful for the patient. Common example, paracetamol suppositories, diazepam rectal gel, any type of laxative or enema. Next, vaginal, inserted into the vagina. Common example, antifungal preservatives, hormonal creams. Ophthalmic, administered into the eyes, any types of eye drops or eye gels. Otic is administered into the ears, any type of ear drops, commonly used for ear infections or also in clearing earwax. Nasal, administered via nose, can be any type of nasal spray. Epidural, into the epidural space, which is around the spinal cord, and common example is epidural anesthesia during child labor. Intrathecal is the route that we administer medication into the spinal canal, which is subarachnoid space, commonly used during chemotherapy and spinal anesthesia. All right, now we know most commonly used routes of medication administration. Now let's learn about absorption of drugs, which is the first phase under pharmacokinetics. Absorption is a process of drug movement from the administration site to the systemic circulation. So, absorption is the process when we take the medication, the journey that it takes to enter the blood circulatory system. Drug absorption is determined by physiochemical properties of the drug, their formulation, and routes of administration. So, depending on the properties of the drug, especially like the form, if it's a syrup, if it's a capsule, if it's a powder, that also affects how the medication is going to be administered to our body, absorbed to our body, and also the formulas used in making the medication, and also the route of medication administration that we just talked about. So the amount that the medication is absorbed, it depends on the route you administer, the where you take the medicine, will tell you actually how much it's going to absorb into your circulation. We are going to talk about it later, not at the moment. The most essential requirement for absorption is dissolution. The process of dissolving drug powders, as absorption can occur only after the drug molecules enter the solution or the system. So it's important to know dissolution or the process of the medication getting dissolved, because if only the medication gets dissolved, this is especially regarding oral tablets or anything that we take orally, it need to get dissolved in order to get administered to the system. So that's why dissolution is important. The dissolved drug molecules must pass through several semi-permeable cell membranes. The membranes are composed of cholesterol and phospholipids. Proteins of various sizes are embedded in and are involved in transport and function as receptors. So, as you already know after you learn biology, the cell membranes are composed of cholesterol, phospholipids, and different types of proteins which act as receptors and helps in transporting different medications. This will be important because some medications are going to act on these proteins. So that's why this sentence is important, but you just don't need to remember this sentence exactly, just get the meaning absorbed into your mind. So drugs may cross the membrane by three main ways, which can be passive diffusion, active transport, and endocytosis. You just don't need to know the definitions of each of these, but you can just know that these are the three main ways that the drugs are going to cross the membrane. But you just don't have to be specific, but if it's helped you, you can just research on these ones by your own. Now let's talk about physical factors that influences drug absorption. The first one is, so there are mainly four types, but there can be more. The first one is blood flow to the absorption site. It's really important. If the route we administer the medication is surrounded by more blood vessels or close to the main blood vessels, the absorption is going to be very high. For an example, the blood flow to the intestine is actually very high when compared to the blood flow to the stomach. Therefore, absorption of medication at the intestine is higher when compared to the stomach. The second one is total surface area available for absorption. So the first one is how many blood vessels there's going to be at the site. And the second one is the total surface area around the medication administration site. For an example, the surface area of the intestines are higher, very high when compared to stomach. The main reason is the presence of microvilli that you might already have learned during your biology lessons. Because of these tiny microvilli, the surface area of intestine is really high when compared to the stomach. So again, the absorption at intestine is going to be higher than the stomach. Third one is ionization of drug molecules. Unionized or uncharged drugs can easily cross cell membranes, while ionized, charged drugs cannot because they are not lipid soluble and have electrical charges that block their entry. So it's important to know, it's actually not that much important to know as nursing students to know if a medication is like ionized or unionized. This is just for your general knowledge. And also the pH level of the absorption site is also important. this one, the ionization of drug molecules and the pH level are actually interconnected. The pH of the body fluids affect how well a drug is absorbed depending on the drug's chemical nature. If the drug is acidic or basic, it it actually affect like its absorption when compared to the pH of the body fluids around the absorption site. Acidic drugs absorb better in acidic environments such as stomach. As you might already know, the gastric fluid is acidic. So acidic drugs are going to dissolve better when it's in the stomach, hence increasing the absorption. And basic drugs absorb better in basic environments such as small intestine. So basic drugs with high pH levels are going to dissolve very well in small intestine because it has a basic environment. The pH level is towards base above 7, so it's going to get dissolved, sorry, lower than 7, so it's going to get dissolved more in small intestine because they stay in their non-ionized absorbable form. So these ones are the physical factors influencing drug absorption. So we basically talk about drug absorption part for pharmacokinetics, but it's also actually there are some other things that we need to talk about, like how many percentage of medication are going to be absorbed through these routes of administrations that we talked about. And there's an important theory about that depending on the blood vessels that are going to be around the site of administration and the total surface area. Like these factors that we talked about, depend on these factors, the amount of medication that's going to be absorbed directly into the system differs. So we are going to talk about that in our next part, and we are going to talk a lot in the next part as well. For now, I'm going to stop from here. So thank you for listening for this part. I will see you in part 2. Have a good day.